Hello, and welcome once again to another episode of the TriDoc Podcast. I'm your host, Jeff Sankoff, the TriDoc, an emergency physician and multiple Ironman finisher coming to you from beautiful, sunny Denver, Colorado. I know that it seems like a couple of weeks since the pandemic dominated the news cycle, and so for many, you could be excused if you thought the whole COVID-19 fiasco was a nightmare in our past. Something to be discussed, but potentially no longer worried about. This misconception is further enhanced by the fact that a couple of Ironman-branded races are actually on the brink of actually happening. One in Lubbock, Texas next week, and the other set for Muncie, Indiana in mid-July. Look, just like all of you, I want to get back on a start line more than anything, but maybe more than most, I only want to do so when it's safe and actually makes sense. The reality, and especially in Texas, where cases of coronavirus are literally breaking records every single day, is that we haven't yet reached a point where either of those conditions has remotely been reached. I'm sure you've seen the video that Ironman put out recently showing everyone their plans for a return to racing. It was great. It gave hope. Gave optimism. Heck, it gave me some enthusiasm that this could even work. But one thing that those videos didn't have in them was 2,000 athletes, many of whom, if recent COVID data is to be believed, and I for one absolutely believe them, will be asymptomatically infected and spreading the illness at these events. Look, I'm sorry, folks, but it is simply foolhardy to be returning to these kinds of events right now, and for Ironman to allow them to proceed puts them on the hook for anything that happens as a result. I know that they're fed up with canceling races and hearing from disgruntled athletes about refund woes, but it will be a significantly worse look for Ironman if one of these events results in hundreds contracting this disease and possibly several deaths as a consequence of that. This is completely preventable. And pulling the pin is simply the prudent and smart thing to do. If you are slated to participate in one of these events, I urge you to think long and hard about whether or not that is really right for you and your family. In the short term, a race seems like a wonderful idea, but the long-term consequences of that could be unthinkable. On the show today, I begin my series on diversity in triathlon, or to put it more appropriately, the lack of it. Based on statistics put out by both USAT and the WTC, triathlon in North America remains an incredibly homogeneous sport with respect to race. Less than 2% of Ironman finishers are people of color, and per USAT, while the number is slightly higher in shorter distance races, it is still nothing to be proud of. Since the death of George Floyd at the hands of police in Minnesota, this has ignited yet again discussions of racism, but this time not just in America, but actually around the world. So I thought that it was a good time to examine this issue in our sport. Why does triathlon remain so persistently white? Do we have a racism issue, or are there other factors at play here? Well, I've had some remarkable conversations on this subject, and I'm really very excited to share the first one of these and the others to come on this and upcoming episodes. Marcus Fitz is the founder of the District Triathlon Team and Grit Triathlon, and as a black man, is one of a small number of USAT certified coaches representing his community. Marcus joined me to talk at length about why triathlon has been slow to grow in the black community, and I know that you will find the conversation as enlightening and entertaining as I did. Before that, though, the medical question for this episode has me discussing the recently published USAT Return to Racing guidelines with a colleague of mine, Dr. David Wyles from Denver Health Medical Center. David is the head of infectious diseases at the hospital, and while not a triathlete, he's perfectly suited to help me and you understand if those guidelines make sense, and if they can, under the best conditions in a real-world setting, allow for us to return to racing in any kind of safe manner. David joins me for that discussion, and that's coming up right now. With lockdowns easing and the numbers of COVID cases decreasing in many areas of the United States and indeed around the world, society is beginning to open up. And with that, people have begun to consider the possibility of a return to racing. Recently, both the USAT and WTC put out guidelines for race directors and athletes proposing a phased approach to a return to events, but in many ways, these raised more questions than they did give answers. For instance, where did these guidelines come from? How much were they based on science, and how much just on opinion? And most importantly, would following them offer the best protection to athletes who are concerned about keeping themselves from contracting this dangerous illness? Well, to help answer some of these questions, I'm joined by a colleague today. Dr. David Wyles is a graduate of Northwestern University Feinberg School of Medicine and currently is a professor of medicine in the Division of Infectious Diseases at the University of Colorado and is chief of the Division of Infectious Diseases at Denver Health Medical Center. Dr. Wyles does a lot of research into hepatitis C virus infection and treatment, and clinically, he's involved in the care of patients with hepatitis C and hepatitis C and HIV co-infection. More recently, since the pandemic washed across this country, Dr. Wyles has taken an active role in the detection and management of COVID-19 infection. But today I am thrilled to say he's been able to take some time to join me on the TriDoc podcast and discuss some of these guidelines and their impact on the possibility of contracting COVID-19 at a future triathlon. Welcome to the podcast, David.
Thanks very much, Jeff. It's my pleasure to be here. This is my first official podcast, I think.
Oh, well, I'll have to be careful and go easy on you. So tell me, David, I don't think you do triathlon, do you?
No, sir.
But you do keep yourself fit. Do you run, bike? What do you do?
I do. I run a little bit, just and mountain bike mostly, and then hiking. In a former life, I played a lot of volleyball in high school and college, and even afterwards.
Oh, okay. Well, then all we need to do is get you into the pool, and next thing you know, we'll have a budding triathlete.
Yeah, right.
So I know you've had a chance to look at the guidelines issued by the USAT, and I'm really curious to get your thoughts in sort of a global perspective as to what you think about these guidelines in terms of mitigating risk.
Yeah, I think, the first thing that struck me, there's a lot of similar themes you see there to things we try to do in other spheres of our lives, right? Trying to modify our practices in whatever it be, in this case, in resuming competition for triathletes, yet doing things that we've now, unfortunately, maybe kind of come to accept as second nature. So ways we can maintain social distancing as we, at the same time, are trying to bring groups of competition. The use of meticulous hand hygiene, what we say when we mean hand hygiene would be frequent hand washing or use of alcohol-based disinfectants. And then for those not participating in the events, and I think this is something we'll get to, is, masking and use of gloves. I think you'll have some questions later about masking in other spheres as training and things go on. But those things all resonate, and they're things we hear about in many spheres of our lives. So it makes sense to use them, I think.
I mean, a lot of times I'm hearing, perusing Facebook or other kinds of social media, triathletes are wondering, why do they even need to concern themselves with this? I mean, this is a generally healthy group. Right. COVID-19 doesn't seem to be affecting a lot of the younger individuals. Is this something they really need to worry about?
Yeah, that's a great question. And I think you're right in that we expect a group of triathletes, obviously, is pretty highly self-selecting group for those who are going to be fit. And they probably are at less risk they definitely are at less risk for severe disease from COVID, from coronavirus infection or the disease COVID-19. I think a couple things to keep in mind, though. Obviously, for the individual, their risk may be lower for severe disease, but you have to think about all the folks they then interact with, whether that be your family at home and whether you might have persons at home who are going to be more susceptible to severe disease. And certainly nobody would want to be in a position where they have a loved one that's more susceptible that they might have brought back COVID infection too, who could get sick. And then there's the public health aspect where even if somebody may not get sick, if they get infected with COVID, they could potentially still be a vector for spreading it throughout the community, throughout their other social circles. So while I agree with you completely for the individual, a triathlete who's healthy, their risk of getting severe disease is probably pretty minimal. There are those other things to think about.
And I guess, we have seen in our own clinical practice that being fit, being healthy isn't 100% protective. People who've contracted this have ended up on ventilators, even though they've been in really good shape before that. So it's not all, it's not like you can just drop all triathletes in a basket and say they're not going to get sick if they get this. Yeah.
Yep, nothing's 100%.
Another thing that I've kind of come across, or an opinion that's been expressed, is triathlons take place outside, and we're seeing now that numbers are decreasing as the weather's gotten warm and people are getting outside, which is a great thing. Since triathlons occur outside and over a fairly long distance, how does that mitigate risk? And again, is this something we really need to be worrying about?
Yeah. And so I think being outside is a great thing. And it almost certainly does lower the risk of transmission. There was a pretty large study that looked at, thousands of transmission events from China, one of the earliest places with the outbreak. And they really could not find much evidence of outdoor transmission. Almost all transmissions seem to occur within buildings, households, particularly among household contacts, things like that. So I definitely think the risk is much lower outside. You just have the air volume, right? We think most of this, or a lot of it, is droplet transmission, maybe even small respiratory droplets, even to airborne transmission. So when you're outside with UV exposure and just the large volume for disbursement of any particulate that's expelled from an infected person, the chances that infection occurs outdoors, I do think, are much lower. There have been concerns, during physical activity, if your respiratory rate increases, deeper breathing, things like that, whether there might be a little further spread or a larger cloud, but that's not really been certainly not been proven. And this gets to one of the comments you made earlier about how much of this is based on just kind of expert opinion, kind of maybe stuff that is intuitively makes sense, and how much is based on data. And I would say, for the risk of outdoor transmission, we have very little data. What we do have suggests it's pretty low in an outdoor setting.
Okay. Well, that's definitely, all of that is good news, especially given that triathletes are returning to outdoor training at this point, and training often with others. Okay, well, let's proceed through some of the various elements of a race and consider some of the recommendations that were made in those guidelines, and consider each of them on their merits. We'll begin first with check-in procedures, and thinking about some of those guidelines and thinking about how effective they would be in reducing the likelihood of transmission if there were individuals either as volunteers or as athletes who may have an infection. It seems to me that reducing the contact points, so keeping crowding down, by having your registration and your packet pickup pretty much all either online or by mail, those seem like pretty good ideas and good public health kind of thinking to try and reduce infectivity and the likelihood of infection amongst a large group, correct?
I absolutely agree with those. I thought some of those were pretty neat and kind of ingenious, and probably actually in some ways may simplify things for contestants. If you can register earlier or pick your stuff up ahead of time and avoid some of the maybe chaos at the beginning in the morning, it all makes sense. I think, looking at other aspects like starting where maybe everybody congregates. I don't know if you're going to get to that later, and I may be jumping ahead, but I thought that was interesting about, staggered starts and whether you can time groups. I'd actually be interested to hear, flipping the switch a little bit. I don't know how much of a sense of being in a race for the triathletes is being in that big group and kind of having, everybody starting at once and kind of running off and being among the groups. And if that would take something away by having, more timing and staggered starts with much smaller groups.
Well, it's interesting. Yeah, it's interesting. Yeah. That's been a debate in the triathlon world over the last couple of years, because Ironman has gone away from the mass starts because there's been so much focus on deaths during the swim. I've actually covered that in an earlier episode, because swimming is really the most dangerous part of a triathlon with respect to sudden death amongst athletes. And one of the things that's been done over the years is to try and reduce the things that stress athletes out. So contact, having the big mass and everything else, and also it makes it much more difficult for rescuers, is to take away those mass starts. So most races these days actually have a self-seeded time trial type start, but you still have athletes together in a large group, sort of in a corral. So we'll get to that in just a second. I want to move to the race morning check-in just a step before the swim, because there were a few guidelines in there that I found maybe, I wondered, almost questionable. And the big one is really fever checks. We know, looking at the literature, that certainly, I think it's a third is what the last I saw, but certainly less than half of patients who are infected with COVID will actually manifest a fever. And I'm just wondering how effective you think fever checks are, because I'm seeing them done pretty much everywhere now.
Yep. That's, I think, a great question. I knew I was forgetting something when I went through that first portion, and that was exactly it. They're going to be done. I think that's the first thing. I think it's going to be hard to get folks away from them, but I think your points are completely valid. So particularly if you're talking about with within a short time frame. So when somebody's coming to check in that morning, the chances of you catching a fever, even in somebody with COVID, as you've alluded to already, is probably pretty low. Maybe less than half, or maybe even a third would have a fever. When we look over the long period, sure, persons who get infected with COVID-19, particularly ones that get admitted to the hospital, they almost all have fever at some point. But again, at any one point in time, you catching that fever and using that as a meaningful way to screen out somebody is unlikely, I think. And we've had instances where the literature has looked at, airport screening for not just SARS-CoV-2, what we're dealing with now, but the first SARS outbreak back in 2002, 2003. And there's really almost no evidence that airport screening really helps you catch anything when you look for temperatures like that. And we have to remember as well that we now have a better appreciation when somebody's infected with SARS-CoV-2, the virus that causes COVID-19. We know there's a pre-symptomatic period where they do appear to be infectious. For most people, that probably ranges from somewhere about to 3 to 4 days. The mean onset is about 5 days for symptoms. And so again, you still may have somebody in their pre-symptomatic period. Doesn't mean they're not infectious, and they won't have a fever. So I share your opinion that it's probably not terribly helpful. I guess I struggle with how to get away from it when it's become so entrenched, but maybe it shouldn't be.
Yeah. And I mean, then the other question is like when you don't have anything objective that you can look for, and that's sort of one you can hang your hat on, I guess it's hard to get people away from it. Right. Another one of these guidelines or suggestions is to have like hand sanitizer just everywhere. And I find that almost comical given how in the healthcare, industry that we're both a part of, I mean, especially yourself in infectious disease, I mean, getting healthcare workers to use hand sanitizer has been an uphill struggle for decades. And now we're just assuming that, triathletes in transition, if we just provide hand sanitizer, they're going to use it, no problem.
Yeah, I think you're right. It is hard to get people to use it routinely. And so obviously, if you don't use it, it's not going to help. The flip side, although we don't really have the data with COVID-19, but we extrapolate from what we do know about many other infectious diseases. If it is used and used consistently, it certainly can work in a hospital setting. Now, again, when you take the alcohol dispenser out of the hospital and right outside the patient's room, and you're moving it to your everyday life, using it at home, wiping down all your surfaces, or using it at the beginning of a race, is it as effective in those situations? This is another area where we really don't have any data to know how effective it's going to be in the wild, if you will, right. As opposed to in a hospital setting.
Okay, and then the last one, and the one that really makes for really difficulties for race organizers, is enlarging transition areas to keep people further apart. Now, intuitively, that obviously makes a lot of sense. Having spent a lot of time in transition areas over the last 20 years, I can tell you that I mean, they would have to, depending on the race. I mean, I think the bigger issue is not so much enlarging transition size. They actually have to just reduce the volume of people, because some of these races, right. Ironman especially, you're talking about 2,000 to 3,000 individuals. And right. I mean, that just doesn't seem tenable right now.
No, I mean, you know much more about the logistics of the transition areas than I would. But yeah, that was the thing that popped into my head right when you started on this was, whether you enlarge the area or you have to reduce the size of the races, or again, as we alluded to, and maybe we'll come back to, the staggered starts maybe decreases the size in the transition area at any one time, although obviously you have racers of different speeds are going to catch up or to each other and may still cluster.
Yeah. Do you have a sense of I mean, I know we're starting to see some guidance from the Colorado Department of Public Health where they're talking about returning to sporting events or sports, recreational sports, talking about, youth sports of like groups of 50, for example. And I'm just curious what your thoughts would be about, if there was going to be a triathlon, I mean, what would be a safe number? Do you have any sense of that?
As an absolute number, I don't really, to be honest with you, Jeff. I think some of it would depend on what the other measures were that you could put in to decrease the size that are congregating in small areas at the same time. In other words, a lot of the guidance that I read through briefly, and some of the other ones talk about mass gatherings and talking about, what's the definition of a mass gathering. And so I think it depends on what type of structural and procedural controls you can put in place, even if you have a large group at the same place to do a triathlon. If you can maintain some spread in that group throughout the course of the event, what's really the effective size of a gathering you're talking about. In terms of what the optimal size is, I wouldn't be able probably to venture an accurate guess, frankly.
Yeah, it's still guesswork now, sure. Okay, well, let's move on to the swim. And, I can't imagine a way you're going to be able to get a large group of people not to congregate around waiting for their start. I mean, that's just the nature of the beast. When you have swim starts in triathlon, people are anxious to get going. They're standing around in their wetsuits. They're just they're milling about. And, every race I've ever been to, people will, move towards the start line, and it just gets more and more dense. That one is going to be a tough one. I really don't know how they're going to get around it. But let's just move past that and just like once people are in the water, I mean, like I said, mass starts are out, so you don't have this huge volume of swimmers altogether. I mean, but you do pass people. I know that when I get in the race, I'm moving past people, or people are moving past me, and we frequently turn to the side and breathe, and it's heavy breathing. Yeah, exactly. Yeah. So I mean, do you have any sense of, this is so hard, obviously, to speculate on, but it just seems to me that it wouldn't be that high of a risk. I mean, I try to think of how many times have I ever caught a cold, swimming? And I would say that I can't remember that ever happening. So it just seems to me that given that this is another type of coronavirus, similar to the one that causes a cold, extrapolating just seems to me that swimming in an open water shouldn't be that dangerous. Do you concur?
I do. I share that sense that I think the risk would probably be extremely low during the swim portion. I actually took a peek. I saw that question in there. I was like, good Lord, I have no idea. But looked on the CDC and some other places. They really don't have any guidance except to say that there's been no documented transmission through water sources. Some of that they're talking about chlorinated public pools and other things where there may be additional things in the water to prevent transmission. But even in, a lake, an ocean, things like that, I would expect the risk of transmission from a swim, even in close proximity, would be extremely low.
Okay. My thoughts exactly. And then, the changes that have been recommended on the bike and the run, they both, again, are similar to what we saw for check-in procedures. They're really geared towards reducing the number of people, fewer volunteers, those volunteers that are there wearing gloves to try and reduce the amount of contact, having racers be much more self-supported, so not necessarily getting hand-ups of bottles. It seems to me that those things all make sense. I guess the one sort of thing I wondered about was not so much for the bike, because the bike seems to me to be the safest part of the course, but really on the run, a lot of run courses have narrow sort of out and back courses where you're really pretty densely packed with runners. Now, a big thing about this virus is that it's not just the fact that you're in proximity to someone, but it really is the amount of time. And it just seems to me that, again, because it's outside, because you're not going to be sitting there. I mean, often runners will chat with each other as they're going along, but for the most part, this seems like a fairly low risk kind of endeavor to me. I again would be interested in your opinion on that.
Yeah, I do think a lot of the same principles, if you will, apply, or at least the same kind of calculus in my head. When you're outdoors with large air volumes or even air movement, the risk during a run is probably pretty small, particularly if folks are going the opposite way. Like if it's an out and back and you're passing somebody going the other way, I think it would be extremely small. I suppose if you're running directly behind somebody for, several miles and are there for 10 minutes or something in that same position, maybe there'd be some risk. But again, there's still so much dispersal when you're in an outdoor environment shortly after exhalation that I think it's still going to be very minimal outdoors during a run.
Okay, well, that gets us to a general question, and this goes beyond just the guidelines for racing. And I want to be clear before we get to this that I am 100% supportive of people wearing masks at this time when they are out and about. If you're going to the grocery store, if you're going to the park with individuals, if you're just out there, doing errands, things like that, I believe completely that you should be wearing a mask. It decreases your risk. It decreases the risk of those around you, and it just makes sense from a public health perspective. Now, that being said, the question is whether or not a mask is really required when you're actually exercising, biking, or running. Again, with this idea that you are on your own, that you're moving, past anybody that you're going to be, who might be walking on the same path fairly quickly, or if you're biking, that you're not going to be, around anybody very much. My feeling again has been, extrapolating from previous experience, I don't remember ever catching a cold just out riding my bike or on a run.
Right.
And it seems to me that COVID-19 shouldn't be all that different. But, there's been these papers that have been published, theoretical papers showing computer modeling, suggesting that when you're running, you're spreading huge amounts of droplets. And I think that they're interesting, but it seems to me that in the real world, the theoretical probably breaks down. And I value your professional opinion on this very much. What are your thoughts about the need for masks when biking or running?
Yeah, I think you've got it right. When you talk about running or biking, and especially as we've already kind of alluded to, if you're going by somebody and the amount of time you're in any proximity to them, and most of the times when you're riding or biking, you're probably not even going to be within 6 feet of people, that the chances of spreading is nil, and that really wearing a mask should not be required when you're exercising, running, or biking. And I did take a little look around. And I couldn't find anywhere that, and in many places, like in New York, there were stipulations that if you were exercising, as long as you kept distancing, you didn't need to be wearing a mask, things like that. And in that modeling paper you're talking about, even the authors themselves came back and kind of tried to clarify things, that this was a kind of a physics experiment, an airflow experiment, not really meant to imply that necessarily transmission would be occurring, but just to show the dispersal of air molecules, kind of the wake of the air around somebody who's running or moving through space on a bike. But again, they kind of, I guess I'm speaking for them, were a little dismayed that it was taken as meaning, that there could be transmission here. That wasn't really the intent of that paper, in my understanding either.
Yeah, I got that sense as well. And, it blew up initially, and it was really taken by, both the cycling and running communities as, oh my gosh. And you'll see a lot of, very menacing, threatening sort of posts on social media from people. Oh, I was in the park and this runner came by without a mask on, and how dare they? And I get it. I get it. The fear is real, but at the same time, again, I think, like you've said, it just seems unrealistic. That being said, if people, feel strongly about wearing a mask when they bike or run, I would not tell them to stop. I just think that it's probably not as necessary. Okay. And then the last question I want to ask, because this is particularly pertinent at this moment when we're starting to see signs of swimming pools opening. What are your thoughts about getting into a pool? Now we've talked about the transmission in water. I don't think that's the issue. I think the bigger issue is just, swimming pools, outdoor swimming pools, probably less of a risk than indoor ones, but still, you're putting yourself in a little bit closer proximity to other individuals. What are your thoughts about swimming? Fairly safe? Less safe?
I think it's fairly safe, or certainly safe. At least the swimming part, I guess. What comes to my mind, if you're congregating outside the pool, or if a triathlete's going to the pool to train, especially in the summer, in an outdoor pool, if it's a community pool or where there's lanes, that are set up for lap swim, but there's others that aren't. The risk is probably the congregation around the pool, not the actual swimming inside the pool. So I think they're just for folks to keep in mind the same social distancing things we've talked about before. Again, I don't think the risk is in the pool when you're swimming. It's going to be around the pool, in the locker room, other things where there might be more congregation.
Yeah. And then, there's been a lot of controversy about how much this virus is spread by contact with surfaces. And I think the jury remains out on that. Sure. And I wonder, I think about my own circumstance with my pool. I have to go into the gym, through the locker room, and then out to the deck to the pool. And in doing that, I have to, operate several doors. Is that something you would worry about?
Is there risk there? There's some, as you're alluding to, the CDC relatively recently came out and kind of backed off a little bit on the risk from fomites, touching foreign objects and getting COVID-19 from that foreign object, and then, essentially infecting yourself after that touching. And it certainly does seem it's close personal contact with droplet, what we would call, so generally within 3 feet or a meter. There's probably some more transmission as you go out to kind of 6 feet from smaller droplets, maybe some respiratory spread. And then it really now starting to look like, that type of touching contact stuff through an inanimate object is probably the lowest of those risks. It certainly does not seem to be the predominant way that COVID-19 is spread.
Excellent. Great. Well, this has been an incredibly helpful conversation. And I think, honestly, pretty optimistic because, right now there are races still on the calendar for people in the fall. I'm having a hard time believing they're going to go off. I think that they will likely be canceled because of just the size of the events themselves. But it's encouraging to hear that there is hope to have these things and to mitigate, the risk of infection to participants and organizers. So this has been a really useful conversation, and I very much appreciate your time. Dr. Wyles is a graduate of Northwestern University Feinberg School of Medicine. He is currently the chief of the Division of Infectious Diseases at my very own hospital, Denver Health Medical Center. And David, I can't thank you enough for joining me today on the TriDoc podcast to discuss the potential for returning to racing in the time of the COVID-19 pandemic.
Thanks, Jeff. My pleasure.
My guest today is Marcus Fitz. Marcus is a Washington, D.C.-based interactive designer, founder of District Triathlon, Grit USA, and is a USAT Level 1 coach. With over 8 years of strategic branding, interactive and graphic design and development experience, his mission is to help businesses identify their why. He believes creative thinking starts from within. It starts from the idea that things can be done differently. Much of his time and passion is spent building creative concepts and visuals to help businesses and individuals share their unique stories and values. And I'm very excited that he has taken some time out of his day to join me on the TriDoc podcast to discuss what really has been something I've been thinking a lot about recently, and that is how to increase diversity in the sport that I love so much. Welcome to the TriDoc podcast, and thank you so much for joining me today, Marcus.
Awesome. Thank you so much for the introduction, Jeff, and I'm really excited to be here.
Marcus, when we got connected on Facebook and in our brief communication since then, I've expressed to you my concerns about the fact that triathlon, as it is today, does not reflect, if you will, the population in general. Less than 1% of Ironman athletes are Black. Why do you think that is? What is the persistent issue in triathlon that keeps it from being more diverse?
Yeah, and this is definitely a question that comes up a lot. I've been on a couple panels with the Endurance Exchange and Triathlon Business International, and it's a common question that keeps coming up no matter where you are or how you talk about the sport of not only triathlon but other multi-sports and endurance sports. And so I swam competitively in college. Which has pretty similar issues to triathlon with inclusion, diversity, and I think that's kind of like where it starts is swimming. That's one of the main factors. It is really, if you can't swim, you can't do a triathlon. So right out the box, if you have that checked, that's definitely a barrier of entry to the sport. And it's not just, it's across the board. I mean, it's huge in the Black community. One, because of, segregation and a long history of access to pools. But among other things, the ability to swim, the access to pools, just general awareness of the sport. I didn't know anything about triathlon until after I got out of college. So you have a huge age gap in the awareness of the sport. And if you look at the demographics that were last posted in 2016, majority of triathletes are between 35 and 45. So most people aren't finding out about it until they're adult. Now that's starting to change, but the lowest demographic of triathletes are actually in their 20s. And that was really surprising to me. And that's across the board, no matter what the race or gender is. And then another reason is finances. So it's in a very expensive sport. You're not just buying shoes to go running. You have to buy a bike and a helmet and, biking shorts and all the equipment to, change a flat tire in a race. And then you have swimming. Most teams and clubs, they have dues, or you need to pay for access to a pool, or even sometimes a track. In DC, we're very fortunate. If you're a DC resident, pools are free for DC residents. And that's not the case pretty much most of the United States. I think, and our pools are actually very, very nice. So we have a lot of benefit to being a DC resident. And within the Black community, some of the high schools have pools, whether aware of it or not. And then I say team inclusion and representation. We have one Black professional triathlete, and a lot of one of the reasons for you want to feel accepted by the sport that you're interested in. And if you don't see, that could be a barrier. If you don't see, someone that looks like you participating in sport, it's like, that sport's not for me because I don't see anybody that is excelling or at least making the sport cool. It's like we're in this era of flash and flare. When you look at basketball and like LeBron James and Michael Jordan, and they have like cool shoes and cool apparel and jerseys. And triathlon really isn't at that level in general. So that's kind of like a unusual barrier in itself.
Gosh, you said so many things there that I want to try and get back to because there's like so much to unpack. I want to really begin with the swimming part because I think that for me, coming from Canada, I did not appreciate the racial background of access to pools. And I wonder if you could go a little bit into that for my listeners who may not appreciate how much of a history of racism pool access. And I mean, it even comes up now. I've seen even in the last year or two, you see stories of Black teenagers having police called on them because they're at private pools that are otherwise white. I mean, this is a long-standing, almost there's a subtext of racism in access to pools that has kept Black Americans from swimming. And I learned a lot about it when, and I'm sorry, I'm forgetting her name, the Black American who won a gold medal. She actually shared the gold medal with the Canadian woman, Penny, in the last Olympics. And that brought a lot of stories about how the racist past of swimming. Could you talk a little bit about that and how that has sort of kept Black Americans from even today going into swimming and therefore also, like you said, triathlon?
Definitely. I mean, I don't even know where to start. There's so many. I mean, we're looking at, like, for instance, the UK. They just had their first African-American woman on the team to compete in the Olympics. This is 2020, gearing up for the Olympics. Now it's been pushed back, but like just looking at that number, that statistic is wild to me. And not too far. Recently we've had Black swimmers on Team USA. So I don't know the numbers or the years or time frame of the history of segregation in U.S. swimming or just swimming period to quote them, but it's kind of been like a good boys club. Certain pools, just like the water fountains, white water fountains, black water fountains. It's pretty similar with pools. A perfect movie for reference would be Pride. Have you seen it?
I have not. I haven't heard of it.
It's a swimming movie that touches based on Terrence Howard's in it. I think Bernie Mac is in it, and a couple other well-known actors are in it. And it kind of breaks down the history of that pool access. It's a team that's trying to create a Black swim team in a time where there really weren't any. And that's a really good reference to kind of understand the historical context of how it's been difficult for Blacks in America to have pool access and to be able to swim safely and openly without restriction.
And my understanding is that in inner cities, there are now programs to try and introduce swimming to Blacks more and more. That is something that has changed in a positive way.
There are, and there's also some that have been created for triathlon as well. DC has a program called DC Wave, which it's an all-inclusive, publicly funded swim team. through DC Parks and Recs. And that's it's huge now. It's only been around for a couple years, and it really, really took off. I'm not sure. I know Atlanta, I've heard of programs in Atlanta for both youth and adults and the elderly, for senior citizens who want to get more active and get their health, like water Zumba and swim lessons and stuff like that. But you don't hear about them. You have to like really search and find them. They're not made readily available. You kind of have to dig or know somebody if you know kind of thing. Which I hope we can get more traction and more awareness to. It's just like, all right, how much money and how much resources are we going to be able to dedicate to raise awareness for these different programs and initiatives?
All right.
Yeah.
And then the other thing you said was about the lack of black professional athletes, and that's something that obviously is very, very obvious. I mean, clearly when you have less than 1% of the athletes are black, that's going to be reflected in the pro ranks. You're going to have a very small number. I looked. I mean, the only one I could find historically was Max Fennell was the first black professional athlete, and as far as I could tell, he wasn't in the sport for that long. And now Sika Henry is the female, very promising black athlete who unfortunately had injuries last year and was looking forward to a good season this year until obviously everything has come undone. So we'll see how that goes for her going forward. But there's no question having someone that looks like you is that, like you said, role models, very important. Do you know, is there a competitive team, or is there any kind of movement to get an elite group of black triathletes?
So from what I know, the team that I created is the only one from the research that I've done. And that's why I created GRIT USA, is to kind of be that bridge. So after creating District Triathlon, I felt that we had created and molded a great entry-level program to bring black people into the sport of triathlon. But then we got to this level, it's like, with the lack of resources and funding, it became hard to kind of cater to the full spectrum of athlete. And so with GRIT is specifically geared to that more competitive athlete. And that's where my focus is, and trying to partner and have a feeder program. We're working with Strive to Try not too long ago as a youth program to kind of feed into a more development program. But they have recently dissolved their nonprofit. So it's been kind of hard finding kind of like a feeding system into it. I think the success for us is going to get into high school program. Because we started young in recruiting runners with natural talent. We can mold swimming and mold cycling, but it's hard to establish a solid run foundation. And I think that's prime for building an elite level triathlete.
Yeah.
It's hard to teach. You can mold it and develop it, but that run foundation, without it, it's hard to make it to that next level of being like an elite level athlete.
Yeah, and the last thing that you mentioned that I wanted to touch on was the finances. Of course, I hear that frequently, and that's not exclusive to black athletes. That's everybody. I mean, it is a steep price of entry to get into triathlon. Obviously, that's gonna affect minority communities disparately because just based on the socioeconomic statistics. I mean,
Right.
Minority communities tend to have less resources in general coming into it. And I don't know that there's an easy answer to that, but it'd be great to see programs that could somehow subsidize minority athletes and not just black athletes. But I did an interview that's going to air after this one with an immigrant athlete, and he mentioned the same thing, where the price of entry is very steep, especially if you're an immigrant who doesn't have that kind of disposable income. I wanted to touch a little bit on what it's like being a black athlete in a sport that's so predominantly white. obviously the extreme case of Ahmaud Arbery is something that, fortunately doesn't happen on a day-to-day basis, thank goodness. But do you encounter, or do black athletes encounter racism at triathlons or while training for triathlons? And if so, I'd like to know about that, because it's the kind of thing that I would want to be watching for and want to know how to make sure that I was, acutely aware of.
Yeah, I mean, I've never experienced like kind of blatant, racism in your face. Like, it's usually more like little microaggressions or like passive statements or comments. A lot of them are usually related to ability, or specifically like swimming ability. So I remember going to races in the past, whether or not I'm actually participating in the race or if I'm like going to cheer on friends. It would be like, you can do this, I know swimming's hard or something. I'm like, oh, I'm a really good swimmer. Like, that's kind of like the least of my concerns with the triathlon. And so like there's this mindset that, all black people can't swim. Or that's kind of, I see that and I hear that, whether or not it's meant to be that way, but it comes off like, oh, you can do this, just get in there and practice and you can do a triathlon yourself. And I'm like, yeah, I was like, I do this. This is my thing. There's no issues here. And even for our team coming in, we have like swag and kits and all that. And there's still like this question of whether or not we'd be able to successfully complete the race, or even from like a cycling standpoint, because I train with a lot of cycling groups, so I can, get my cycling ability up and race more competitively within triathlon, but also within the world of cycling. And I'll get the comments like, oh man, how'd you get your bike? What do you mean? Like I paid for it, Like, just like anybody else here, like I worked for my bike and I paid for it, just like you. So you have those, whether it was meant to be like that, but there's this stereotype or subconscious, if you will, that may not come off or may come off like that, but they may not think about, I guess.
Yeah, I don't even know what to say. I'm speechless. Yeah. See, I constantly find myself wanting to apologize, even though it's not for me to apologize. But yeah, anyways. Okay, so, here we are at a moment where I think optimistically, I'd like to be optimistic about this. I feel like we're on the brink of change, real change. And that is for the first time pretty much in all of the years that we've had these kinds of conversations. And that's a really good feeling. So, I've been in triathlon long enough to have seen some of the diversity, initiatives come and go without any real like oomph put into it. I saw the statement that Andrew Messick put out. I thought that I thought it seemed pretty good. I was curious what your thoughts were about what he had to say, and if you had any thoughts in addition to what he said about ways that, triathlon could be made more diverse and more welcoming for black athletes.
Yeah, I think generally in the sport of triathlon, there's been a lot of unease with the relationship between USA Triathlon and Ironman, just in general, of how they approach, their races. Ironman does put on very well organized races, but how they go about their race planning has been a little controversial in certain areas of the U.S., even the world. The statement that they made, I'm glad they made a statement and they actually had action steps. I thought that was great. It did take them a long time to make a statement. And I think the statement came from, there was a lot of pressure from the community about asking them to make a statement, and also within their internal groups, Women for Tri. There was a lot of conversation amongst them, and, you know, some of the other like various Facebook groups for Ironman and the Ironman coaching and USA Triathlon coaching. So there was a lot of pressure put under them to make a statement. And so my only thing is, I'm glad they made it. I hope that they take the time and execute the steps that they said they will. And I'll be looking forward to seeing how it all kind of plays out and unfolds. I mean, other than that, you know, I can't really say, you know, much else about it. But I'm excited about the steps that they're taking, and I hope some of the other organizations follow, because we have a lot of really amazing local race series that have been talking about how they can be more involved in the community. And, you know, is it worth like doing clinics the day before a race or the day of a race to teach people how to swim, or create clinics and camps for kids to get involved in, you know, learning about the world of triathlon, because it's a lot of moving pieces, more pieces than people realize. And also from coaching and race director certification programs, it's like making them accessible to urban. I don't really like the word urban, so more like, you know, inner city communities, so that they don't have to travel out to like Colorado or, you know, the West Coast or Arizona to just get certified.
Yeah, those are great points and great things. What can the individual white triathlete do to make the sport more welcoming? What can we do? I mean, besides avoiding some of those obviously, you know, insensitive types of comments. You know, I'm at my next race. I see a black triathlete at the race. What can I do to make that athlete feel welcome?
Yeah, I mean, I think just, you know, treating people like human beings is just a great step. I mean, with any situation, regardless of race or you know, gender, it's just being mindful of you know, words. You know, sometimes words hurt and you don't realize that, you know, so being mindful, you know, before you speak. And even if it was out of, you know, there was no ill intent, sometimes it does. And, you know, it's just, I think just being mindful, you know, being mindful and treating people, but like human beings. You know, everybody's at a race to do the best that they can and have fun. And, you know, the same way that you would like to experience a race, you know, that other person, regardless of race or gender, is there to experience the race probably in a similar way.
I mean, just wise, sage words. Thank you, Marcus, for everything today. I really appreciate the conversation. Marcus Fitz is a coach. He's the founder of both District Triathlon and Grit USA. You can find websites for both of those on the interwebs. And Marcus, you are taking on athletes. What is the status for your coaching right now?
Yeah, so I'm taking on one-on-one athletes. And also, I mean, our grit team is capped at 15 members right now for the season. So next year at the end of the season, we have kind of like a tryout process for the following, and it may remain at 15 or it may grow. We're just going to, I mean, this year was kind of like it was what it was. So next year may look different, but we try to decide everything as a team, and we'll have all those details on either our social media or website.
Awesome. Well, I wish you the best of luck with that, Marcus, and best of luck moving forward with everything that's going on right now. And thank you again so much for being on the podcast and helping us understand this complex and, you know, hopefully changing issue.
Definitely. Thank you so much, Jeff, for having me. And, you know, I'm really excited to see what future interviews hold.
And that's it for another episode of the TriDoc Podcast. I hope that you enjoyed listening to it as much as I enjoyed bringing it to you. Do you have questions about any of the issues discussed on this episode? Or do you have a question that you'd like me to consider answering on a future episode? Well, send it to me at tri_doc@icloud.com. If you're interested in coaching services, please visit www.try.coaching.com, where you can find a lot of information about me and the services that I provide. You can also follow me on the TriDoc Podcast Facebook page, TriDoc Coaching on Instagram, and the TriDoc Coaching YouTube channel. The music heard at the beginning and the end of the show is Radio by Empty Hours and is used with permission. This song and many others like it can be found at www.reverbnation.com, where I hope that you'll visit and give small independent bands a chance. The TriDoc Podcast will be back again soon with another medical question to answer, and I'll continue my exploration into why triathlon remains so persistently white, as told by the participants who make up the small proportion of diversity athletes who get to the start line every year. Until then, train hard, train healthy.